Hello, and welcome to episode 3 of our Sepsis 101 podcast. Today we're diving into a life-saving topic, sepsis prevention and early detection. As we talked about in our first episode, sepsis is a medical emergency that claims hundreds and thousands of lives each year. But with the right tools, knowledge, and practices, we can reduce its impact dramatically. Let's get started.
Sepsis is the body's extreme response to an infection. It can lead to tissue damage, organ failure, or even death if not treated quickly. The key to surviving sepsis is spotting it early on, as discussed in our first episode. Symptoms to watch out for are high or very low body temperature, rapid heart rate or breathing, confusion, and disorientation. If you or someone you know experiences these symptoms, especially after an infection, seek medical help immediately. Early detection is often the game changer when preventing sepsis.
How can we use vaccines and hygiene to aid in the prevention process?
Okay, so preventing infection is the most effective way to reduce the risk of sepsis. And this is where vaccination and hygiene comes into play. Staying up to date on vaccines such as flu vaccines and pneumonia shots can help prevent infections that could potentially lead to sepsis. Regularly washing your hand with soap and water for at least 20 seconds might sound simple, but is really crucial. Cleaning cuts, scrapes, or wounds quickly and keeping them covered to avoid infection can also help. Properly handle, cook, or store food to prevent foodborne infections.
Oh wow, so most of the prevention process can take place at home, is that right?
Yes, because by maintaining good hygiene and staying vaccinated, you're already taking significant steps to protect yourself and others from sepsis.
Okay, so what do healthcare professionals typically do once patients arrive at the emergency department for signs of sepsis?
Okay, so they often conduct rapid assessments for vital signs and symptoms, blood cultures to monitor infections and organ function. They also administer a broad variety of antibiotics, IV fluids to stabilize their BP and improve circulation. And there's many more monitoring that's done at the hospitals as well. And early intervention saves lives, and hospitals are constantly improving their processes to reduce sepsis mortality rates.
Okay, so how can the public be more aware of sepsis?
So public awareness plays a critical role in sepsis prevention and detection. Many people don't even know what sepsis is until it's too late. Advocacy groups, healthcare providers, and community leaders must continue to educate the public about recognizing the symptoms, the importance of early medical attention, and preventive measures. Sharing stories and experiences is a very powerful way to spread awareness. If you or someone you know has been affected by sepsis, consider speaking out. Your voice could save multiple lives.
So what are the simple steps to protect yourself against sepsis?
The simple steps everyone can take to reduce their risk is staying up to date on their vaccines, practicing good hygiene, especially hand washing, treating infections promptly, and visiting the doctor if symptoms worsen, knowing the signs of sepsis and acting fast as they appear, advocating for better sepsis education and healthcare protocols in our community.
Okay, that's it for today's episode on preventing and detecting sepsis early. By understanding sepsis and taking preventive steps, you can protect yourself and your loved ones. If you found this episode helpful, please share it and subscribe to our podcast for more sepsis-focused content. Until next time, stay safe and stay informed. Thank you so much.
Thank you.